Hello, anatomy colleagues. This is Dr. Alsup, and in this video, we will be discussing the muscles of the gluteal region, which is that posterior transition between the pelvic girdle region to the lower limb. And we only have one learning objective, but certainly not one that can be answered in one or two words, so many aspects to this learning objective, so take your time here. The gluteal region can be subdivided into a superficial layer, which is composed of the gluteal muscles, and a deep layer composed of smaller muscles, which primarily rotate the hip. And with the gluteal muscles, there are going to be three. We commonly refer to these as the glutes. And a lot of times when people are thinking about the gluteal muscles, they are really thinking about the biggest and the most superficial one, which is the gluteus maximus. But there are two others, with the gluteus medius being intermediate, both in size as well as in terms of depth, with the gluteus minimus being the smallest and the deepest of the gluteal muscles. In general, you have to reflect one of these muscles in order to see the deeper one, although you can usually see a little bit of the gluteus medius, its superior-most portions, even when the gluteus maximus is in situ. And these muscles will all affect the hip joints. So let's talk about these muscles, starting with the biggest one, the gluteus maximus. It is a big muscle with a capital B-I-G. In fact, it is the heaviest and most coarsely fibered muscle in the body. And when dissecting this muscle in the lab and reflecting it to see deeper structure, students are often surprised and maybe a little frustrated during the dissection to understand how big this muscle is. Sometimes you reflect it and realize you didn't get all the fibers reflected because it's just that thick. It crosses the hip joint and it has a few distal attachments, but the biggest one is into the iliotibial band or the iliotibial tract. You often hear this referred to as the IT band, which is IT band is a notably thickened area of the deep fascia on the lateral side of the thigh. The muscle is innervated by the inferior gluteal nerve, which is different from the other gluteal muscles, so that's an important distinction there. And with it being such a big muscle, you can imagine that it's also quite powerful. And it is an extremely powerful extensor of the hip, particularly when force is necessary. So think extending from a flexed position, like getting up from sitting down or climbing something, squatting, all of that good stuff. It is actually rarely active in the more passive extension of the hip joint, like standing motionless. If you're just standing upright, your gluteus maximus isn't working that much, or even just casual walking. It is also a lateral rotator of the hip joint, like many of the deeper muscles in this region. Moving to the gluteus medius and minimus, and we will actually talk about these together because they do share many common things, including a distal attachment, they share an innervation, as well as actions. But again, as I mentioned before, the gluteus medius is bigger and superficial to the gluteus minimus. The gluteus minimus is actually on that same plane as many of those lateral rotator muscles. So that is something both the deeper gluteal muscles plus the lateral rotators of the hip joint share is that they're all attached on this the greater trochanter. Almost all of them are. And that's why the greater trochanter is so big, because there are so many muscles attaching there. The gluteus medius and minimus, plus a neighboring muscle called the tensor fascia lata, which I'm not really going to assess you on. These are all innervated by the superior gluteal nerve. And the main action of these gluteal muscles is to abduct the hip. And that is particularly important when the foot is off the ground. It slightly abducts. It will medially rotate in order to prevent the hip from dropping to the unsupported side. You need the hip to abduct slightly to keep the pelvis level. That is why you often hear a major role of these gluteal muscles is to stabilize and support the pelvis because it supports it by helping it stay level during locomotion. So if you had an injury to the superior gluteal nerve and the gluteus medius and minimus become paralyzed on one side, when you lift your foot on the opposite side, the paralyzed side cannot abduct the hip, and therefore it cannot stabilize the hip, and this causes a dip on the side that you are lifting your foot. This is called a positive Trendelenburg test with this type of presentation. Lastly, we have those lateral rotators of the hip, of which there are 5. And most of these, as mentioned, will have an attachment on the greater trochanter of the femur. Piriformis is one of these muscles, and it is a landmark in this deep gluteal region because neurovasculature will either exit superior or inferior to the piriformis muscle. In fact, this is where the superior and inferior gluteal nerves gets its name. The superior gluteal will exit superior to the piriformis through the greater sciatic foramen, and the inferior gluteal will exit inferior to it. And the sciatic nerve will also exit inferior to the piriformis. That is sometimes why you hear the piriformis referred to as the key to the hip. I have here that it is deep to the gluteus maximus, which is true, but it's also, these muscles are also deep to the gluteus medius. And again, lateral rotation is the primary action, but many of these muscles will also play a role in terms of abduction of the hip joint. All right, practice question time. This is a nice second order question, similar to those that you may see on the exam. You notice that an individual is having difficulty with powerful extension of the hip joint. You suspect that there may be nerve compression leading to this presentation. So which nerve may be compressed? Think about it a moment, look at these answer choices, and when ready, let's discuss. First off, some of these answer choices, I hope you can just mark off immediately. You know that they are wrong. So the axillary nerve is one of those. It's a nerve of the upper limb, so not it. The hypoglossal nerve is even higher. Do you remember what it innervates with, or innervates? Hopefully you remember it innervates the muscles of the tongue, so definitely not the right answer. These other 3 answer choices do innervate muscles of the lower limb, so we're more in the ballpark here. We actually haven't talked about the tibial nerve yet, but it is a subdivision of the sciatic nerve, and it will innervate muscles of the posterior thigh and leg. Now, we will talk about how the hamstring muscles of the posterior thigh will extend the hip, but it is not the powerful extension like you have with one of your gluteal muscles. It's more for casual walking or just standing upright in regards to hip extension. So this isn't the correct answer either. So we are left with the gluteal nerves, which makes sense as this video is on the gluteal region. And at this point, we likely need to remember which one of those gluteal muscles is a powerful extensor of the hip joint. And that is that large gluteus maximus muscle. Now, which one of these nerves innervates the gluteus maximus? Remember, it has its own innervation. And that is the inferior gluteal nerve is going to be the correct answer. The superior gluteal nerve innervates the gluteus medius and minimus. Excellent. Hopefully that was a nice review and a possible way to think through a second order question. Thank you so much for your time and attention.